Hi, everybody. Welcome back to Beauty Inside and Out. You know, my guests today are Kim Clark, Dr. Emer, and Dr. Cohen, and they're all very, very, very knowledgeable about the type of programs, techniques, services, treatments that are going to help you to be beautiful inside and out. And we're talking from external, non-invasive. We're going to go internal here shortly with Dr. Cohen about some of the more evasive type surgeries, but how to be able to not only keep that youthful look, but also to be able to be as healthy as we can for as long as we can. And I think that that is a part of it too. I think a lot of times we look at cosmetic surgeries as a vanity type of approach, but today with all the technology, I know that there's procedures. I know that there's so many different things that we can all try in order to look our best, feel our best, and be our best. So, Kim, before we took a break, I asked the question of what are the celebrities doing? Because of course we all want to know, what are you seeing in that actual world of the treatments that you offer that give that celebrity look?
I would say probably dermal infusion, if it's right before an event. It gives a really good deep exfoliation and extracts all the dead skin cells off of the skin. And then it infuses with a skin-specific serum that I choose for them to plump the skin up. So it gives them a really good glow right away.
I like that. And no downtime on that. They can just kind of look their best right away.
No, they look great. As soon as they leave, they look amazing. Yeah.
Perfect. I love that. Good. You know, Dr. Cohen, I'm excited to be able to talk with you a little bit today. I know that you're both in Arizona and in LA with Dr. Emer here, and you're focusing on impeccable breast surgeries, revisions. Listen, we're going to go down the path of saggy boobies and too big of boobies and how to be able to overcome that, because I think that's also not just a vanity surgery. I think that's sometimes like a health concern for some people. Absolutely. At that point. And of course, we know that that's going to make them feel better, but give us a little insight. And Dr. Emer's done such a good job of giving us some insight already as to what you do, but give us a little insight of the type of patients that you're working with and what they're asking for.
So, you know, traditionally I took care of mostly female patients, and since I was doing a lot of breast and body surgery, aesthetic surgery, my patient population tended to be like mid-20s through probably mid-40s on average. A lot of moms who had a lot of pregnancy changes, probably my most common patient that I was seeing, who had breasts that either lost their volume or stretched and drooped, and they had abdomens that got stretched out from pregnancies. And these are problems that they couldn't fix with diet and exercise. So what would happen is it would be very discouraging for these patients. They just felt a loss of confidence. Sometimes I had patients who said that they wouldn't let their husbands see them in the nude with the lights on, which is really unfortunate. It would affect what kind of clothes they'd wear, or whether they felt comfortable going to the beach. So this became not just like it definitely, people sometimes worry like, oh, this is vanity surgery. It's more of like a lifestyle in terms of like being able to feel confident and happy and enjoy your life. Unfortunately, for whatever reason, you know, obviously how we look and is sort of how we present ourselves to the world. And when people don't feel confident in their appearance, it can affect them in a lot of ways, whether it's intimacy or just interaction. So, so I used to do a lot of transformations where I'd take people and fix things they couldn't fix on their own. And what that would do is it would set them up for all sorts of other positive benefits. I'd see patients who weren't exercising, who now that they felt comfortable having fixed things they couldn't do themselves, now they were going to the gym and really seeing results and being really excited, which was good for their health. Or I'd have patients stop smoking because I won't operate on smokers, and then they would say, oh my God, I feel so much better, and you know, maybe I'd save them some lung cancer down the future, hopefully. Or patients who would come in with very sort of subdued personalities, who just clearly were very self-conscious and just felt bad about themselves. And I had some patients who literally were almost like a different person. They'd come back and they had this glow to them, and they were like outgoing. It was really like almost even for somebody like me who kind of been trained like that, to see this actually happening was really mind-blowing sometimes. Like how big of an impact, these aren't necessarily life-saving surgeries, but they can be life-altering surgeries for a lot of these patients. And then, you know, for certain patients, like you're saying, if they had very large, heavy breasts with back and neck pain and a lot of problems, I could do a breast reduction, make them not only look a lot better, but all these symptoms would go away, and they could, again, exercise effectively, and they could just walk around throughout the day without feeling that they're constantly pulling weight off their shoulders and stuff. So that was the kind of stuff I was seeing. And then when I started working with Dr. Emer, the types of patients I saw started to change a little bit. So I was seeing more male patients that were coming in for these high-def liposuction cases where we would do combination surgeries to create it was stuff that was like next level from what I was used to seeing, where people already looked pretty good and we're taking them from good to like insane. And, like basically men's health models at the end of the surgeries, which was mind blowing to me. And then we're also seeing, just various patients that need combination treatments where they're getting liposuction and internal heating by Dr. Emer. Then I'm doing the skin resection and tightening, and we're doing different body parts and combinations. So we're really doing these like massive transformations on some of these patients, which really it's very satisfying because it's just stuff that you don't see a lot, even presented at the meetings. You don't see kind of these level of results.
Yeah. Oh, I totally get that. And it is life altering. When you feel better about yourself, you're going to take better care of yourself. I totally get that part where it's like, I just want to look a little better, and then I'm going to take on more of a healthy attitude to maintain and to do that. I think when people kind of get to the point where they let themselves go a little bit, it's hard to get that self-esteem back in there. And you mentioned something which was interesting. You said that that you don't do surgeries on smokers.
Right. So, smoking is a very high risk factor for complications after surgery because the nicotine in smoke constricts the small blood vessels. The carbon monoxide in smoke binds your hemoglobin and reduces your oxygen carrying capacity. And so both of those things reduce oxygen flow to the tissues, and oxygen is what helps you fight infection and heal wounds. So I almost never have wound healing issues. And I had one patient who literally started smoking the day after a breast reduction, and she had a wound healing problem. And you could trace it to it was doing perfectly up until she had that cigarette. So I'm very, very strict with my patients. And the thing is that for people who are smokers, like, you can tell them, oh, you're going to get lung cancer. It's going to age your skin. It's going to do this and that. They're like, okay, well, I'll deal with that when it happens. You tell them, you're not having your surgery unless you stop smoking. And I'm going to test your blood to make sure your carbon monoxide levels are where I want them to be so it's safe. And I do this not because I'm trying to be mean. I'm doing this because I want them to heal properly. But once they have that like immediate motivation, they will do it. And then once they stop the smoking and they realize I'm looking better, I'm feeling better, then it's like it carries them to the next level of health. And so I can't tell you how many people have hopefully stopped smoking. And I think all those people are going to get years added on to their life because of that. So that's kind of like a side benefit. But it's really like you can't underestimate how much physical appearance can be a motivating factor for people to do other things that are going to be in their best interest for their health. So it's nice that we can kind of push them with the kind of the carrot at the end of the rope kind of deal.
I love that. I love that you care about them that much to really look at that. And that honestly, that's, if they want to be healthy, that's got to be a number one area of opportunity. Stop smoking, you'll be healthier.
Safety is always number one. So I would sooner not do a case than put a patient at undue risk. So there's always anything we do in life, surgery, driving our cars, whatever, there's going to be some inherent risks involved. But as a surgeon, it's my job to make sure that any controllable risks are controlled. So that means no smoking and all the other things that need to be done. We do a lot of we do the big combination surgeries between me and Dr. Emer. We have them do hyperbarics. We have them do lymphatic massage, really aggressive post-operative care program. Again, it's patients sometimes think it might be a hassle or extra expense. It's to make sure that they get the best possible results with the lowest risk of complications. And that's ultimately our goal.
Where is the trend, Dr. Cohen, right now with people wanting breast augmentations, just in fact, larger breasts? Because I know it was a big trend for a while there. Is this still kind of that same trend? And also, where's the safety factor? I know you talked about fat grafting and stuff like that. So can you fill us in? Because I just saw something on the news the other day about, these a recall on the breast implant.
Yeah,
and
so
thousands of women are up against what now? What do I do?
So basically, in general, implants are still an extraordinarily well-studied and very safe device.
Okay.
Millions of people, literally tens of millions of women have implants in. Most of them do very well. And hundreds of thousands of women every year are getting implants placed. And the reason we put implants is when women need more volume for whatever reason, either just purely aesthetically or they've lost volume and they have loose skin. And the only way to create a nice aesthetic shape is by having that extra volume. That's good. So we have implants as a tool to help us in the way we make reshape women's breasts. Not everybody needs implants. So I see a lot of patients who come in who already have enough natural breast tissue where I can just lift and reshape what they have, or fat grafting. You can borrow fat from areas of the body that you don't need it, and then process, purify it, and re-inject it in the breast to add extra volume, sometimes in combination with lift surgery. So there's a lot of choices that we have, and that's really the key. Is when you're working with a very experienced surgeon, they're going to have every tool available to them. They're not going to just, like they say, if the only tool you have is a hammer, the whole world looks like a nail. And I see patients who come in who need a breast reduction, and they'll tell me, oh, another surgeon said I need implants, and I'll say, well, why would they recommend implants when you already have too much of your own tissue? So you have to think about the breast surgery is very nuanced. There's so many details. Now, as far as the implants, we're in a little bit of a weird time again because of the issues with textured implants. That's what you were talking about. And it's sort of a complicated subject. There's a very, very rare type of cancer called ALCL, which stands for anaplastic large cell lymphoma. It's only been seen with textured implants. To put it in perspective, there's been less than 1,000 cases worldwide out of probably tens of millions of patients with textured implants. So it's extraordinarily rare and a very curable situation, but something we take very, very seriously. And the BIOCell, which was the texture on Allergan implants, that had a much higher ALCL, even though it was extremely low still. It was a higher rate, maybe in the 1 in 3,500 to 1 in 30,000 range, compared to maybe more in 1 in the 70,000 or 1 to 100,000 in some of these other implant brands. So that particular brand was pulled off the market because of that risk. They're not pulling texture completely off the market, and smooth implants have no risk of that type of illness.
Okay, got it. Yeah, so that helped. I think,
So,
to educate our listeners a little bit here.
Hopefully, and there's a lot more details. I mean, I could talk about this for an hour, but or more. But with implants, again, I think the general trend, not everybody, but my personal philosophy has always been natural, proportionate, beautiful results. I want something that looks like it could fit on that person. There's some leeway, obviously. Some patients want a smaller looking breast. Some people want a fuller looking breast. So I try as best I can to accommodate what patients want. But at the same time, you don't want to exceed what their tissues can handle. And you want something that's not going to look ridiculous, or at least I don't want something that's going to look ridiculous. And there's surgeons, if somebody wants like 2 water balloons on the chest look, there's people out there who will do that. But that's not something I want to do to patients, because it doesn't hold up well over the years. So in general, though, I was going to say patients tend to come in wanting a more natural look these days. People don't really want that giant round circle on the chest because it just doesn't look good. Just like Dr. Emer was saying, people are not coming in as much, thankfully, wanting like the big duck lips and the big overstuffed cheeks. It's just not a good look. And unfortunately, these exaggerated appearances start to become normalized. And what we as surgeons have to do is kind of rein people in and say, this is not what humans are supposed to look like. Let's make you the best looking version of yourself, not like something that doesn't exist in nature. So that's always the goal, is natural results. That's really what holds up the best. And
I think if somebody is going outside that realm of natural, then they might need to be, getting other type of treatments from other type of doctors. And not necessarily.
There are certain people who just no one say no.
Yeah, absolutely. I agree with that.
No one say no.
So between this fat grafting, so how long is that process taking? So you were talking about, just use some of your own fat to create some of that filler. Is that over time, or does that all happen in one surgery?
Well, it kind of happens in one surgery, although you can do multiple rounds of fat grafting. But what you do is you do liposuction, and that gets the fat. So obviously patients who want to have fat grafting, there's a number of criteria that have to be met. So you can't just do it for anybody. Somebody has to have, pretty decent size pockets of fat excess where you can harvest it, and then you can put it back in at the same time where you want it. It's not injecting a big pool of fat, kind of like an implant. You're injecting thin threads of fat. Each thin thread of fat that you inject acts like a filler, and it gets blood supply from the surrounding tissue that keeps the fat alive. Now, what I always tell patients is it's not as predictable as implants, because of the fat that you inject, not all of it is going to stay permanently. Some of it gets reabsorbed by the body, but you're generally hoping for about a 60 to 70% take of whatever you inject staying long term. But the nice thing about fat grafting is it's like the ultimate filler. It's your own tissues, it's soft, it's natural, and once whatever's kind of there after 6 months is there permanently. So now you have more fullness where you want it and less fullness where you didn't want it. So it's kind of a win-win situation for people who are good candidates. Surgery.
Dr. Cohen, do you do any reconstructive surgery for women that might have had to have mastectomies or even scarring from?
I don't do breast cancer reconstruction anymore. I did hundreds and hundreds of reconstructive cases during my residency, but just based on how my career played out, I ended up doing more aesthetic surgery. That being said, I do a lot of revision surgery where I'm fixing botched cases and other things that have gone horribly awry. These cases are just as bad, if not more deformed, than some of the patients who've had breast cancer. Thankfully, they don't have to worry about the cancer risks, the chemo or the radiation, so that's huge. But in terms of the actual tissue damage or the appearance of the chest, I've seen some patients who have horribly damaged breasts. So those are basically, they're essentially reconstructive surgeries using a lot of different aesthetic surgery techniques to make somebody look from deformed to normal again.
Yeah. Yeah. So then,
there's a lot of crossover between breast reconstruction and aesthetic breast surgery because a lot of the techniques do have applications in both areas.
Well, and there's such new technology and there's just so much more refinement of what you guys are doing as surgeons in relationship to the body and everything, that it's a good time to be interested in looking at some of these techniques and procedures and treatments and everything. Yeah.
Yeah, well, we keep pushing the frontiers. You know, in the old days, there were like a few different ways you can do breast reconstruction. Now we have so many different options for patients, nipple sparing techniques, if it's prophylactic mastectomies, for example. So, you know, there's cases now where the people look better after, you know, breast cancer reconstruction than they did before the reconstruction in the first place. So we're like I said, the reconstructive and the aesthetic stuff are starting to kind of come together in a lot of ways, and both areas kind of help each other out in terms of pushing the limits and trying to create better and better outcomes.
Yeah, perfect. What are some recommendations, and any of you guys can answer this, so just, you know, feel free. What are some recommendations that you'd like to share with our listeners if they want to check into doing something? What are some questions they need to be asking, you know, in order to kind of like, I think the consultation part is very intimidating for most patients to go in and sit down, and because you feel very judged, I think, you know, it's like, oh, well, you could use this, you could use that. And I'm saying this only, it may not be how you guys do it at all, but I'm saying it because we see this type of thing happening on TV. So we assume that we're going to go in and that somebody's going to tell us we need, you know.
What don't you like about yourself, like a nip tuck, right?
Yeah,
I mean,
exactly.
if you see a good surgeon, you should not get the impression that you're being judged or that they're like looking you over and saying, okay, this is wrong, let's fix this, fix that. Like, I think most surgeons, or at least in my own case, I'll lead with an open-ended question, like, you know, what brings you in? And I'll hear what bothers them. I'll look at the areas. I'll give them choices as far as what I think I can do to get them the best possible results. If there's other things that are going to affect that surgery that they're not aware of, I'll bring them up in a very gentle way, saying, you know, this is going to affect the surgery that you want to have, and if you want an even better result, you may want to consider this or that. But it's all done in a very like positive communication way with the patient, so they don't feel embarrassed or judged. They feel kind of comfortable. They can ask any questions they possibly have, and they know that I'm going to know every possible surgical option for them, and then we're going to discuss it and make a decision together as a team, not me as a doctor telling them what to do, or me as a doctor doing exactly what the patient tells me, because they're coming to me for my expertise to make sure that if they have an unrealistic idea or they want something that isn't going to give them a long-term good result, I'm going to be honest and tell them that's not the best way to do it, you know, because that's part of that communication process.
I think that's really important. So at this point, they're coming in, you're asking them enough questions to be able to get an idea what they want, and you're helping them with what downtime is going to look like, what, you know, what.
By the time the patient walks into surgery with me, they should really have no significant questions. They should be very well informed. I do a lot of educating all over the world. I teach other surgeons how to do surgeries. I teach them how to do these different techniques. I also teach them how to manage patients' expectations and communicate with patients. These are all extremely important facets of what to success. So communication is the key. So when you say to a patient, you know, how do you kind of start this process? I mean, obviously the website is going to be the first thing. You want to see that the doctor is certified and the board certified in the area that they're going to be operating on with you. You want to make sure that they have excellent training. You want to see lots of before and after photos, so you can, because we're talking earlier about, you know, patient comes in, they trust us. Yeah, they trust us, but it's not like blind trust. They've seen hundreds and hundreds of before and after photos of mine and Dr. Emer's where they know what to expect. They also can, they have a chance to meet with you and make sure that the personalities are a good match, because it's a relationship you're forming. It's a medical relationship. you don't like, the old days of like, oh, I hate that surgeon, but he's really good. You don't need to do that anymore. You should not only, you don't have to be best friends, but you should be able to feel comfortable with your surgeon and feel like not only are they highly skilled, but they're also somebody that I can talk to. Because I always tell patients, you really find out a surgeon's personality, not when everything goes smoothly, but if you have any kind of complications. Are they the kind of guy that's not going to answer your phone, or are they going to be all over it and bringing you in and making sure that you get the best results possible despite having a complication? Because the best surgeons in the world occasionally are going to have problems that happen, and you need to be able to handle those problems and fix them in a way that makes the patient feel comfortable and cared for.
Right.
Yeah, it's all about really good communication. And I was talking to a patient the other day. I've been doing his fillers for a long time. He's very famous, so you can't have anything that goes wrong. But one or two times there was a little spot here or there. I mean, anyone can get mad. Anyone can. I mean, all it was a phone call to me. Let's bring you in. Let's fix it. Let's smoothen it out. He's been my patient for 5 years. He's like, the reason I love going to you is I have this great relationship with you. If I'm not happy about something, we fix it, we tweak it, we make it right, I move on. It's about me being with you long term. And that's the thing is, patients, the initial step is coming in. And I think now people want to know their doctor and know the person before they even get there. And so he talked about the main things. The other part we didn't bring up was social media. A lot of reasons I do a lot of live videos, which very few doctors do, I believe. They're starting to, but they're not as much, is because it really shows everything you're doing intricately. You can't make a mistake, or you really shouldn't, when you're doing a live video. You're very focused. You're showing, you're educating. We're doing immediate before and afters when we do fillers. We're showing the person's satisfaction right away. People see how we communicate as we do it, how my nurse rubs the person's shoulder while they're getting the injection, the ice packs, every component of the full procedure. I had a young guy who came yesterday in our clinic who had never had anything done before, but for 2 months he was saving up to get facial sculpting. He's a bodybuilder, very lean in the face. He did fillers and everything, and it was all because he watched every facial sculpting video I had, every live video, and my relationship with the patients. It wasn't even the result. It goes beyond the before and after. Now it's looking at how does he communicate when he's treating somebody in surgery? How is he talking when he sees the person after the surgery? Like, we do a live video a week after a person's in surgery showing the result. How are we talking to the person?
I think that's helpful. I think that's really helpful for clients and patients to be able to say, this is what I can somewhat expect in my own situation. And plus, they're getting to know you as a doctor.
Totally.
I mean, the relationship is being established online. So, with that, and Kim, I think that's really important for you, because even though you're doing kind of the non-invasive maintenance and the relationship you have with those patients and those clients that are coming in is critical, because otherwise, once you stop, you're not going to continue to have the results that people are looking for. Yeah.
And I think it's important to get to know the client, like what they do for work, what they eat, do they drink, what amount of water do they drink, alcohol consumption, smoking, like I said, like where they grew up, all of that plays into the health of their skin.
Yeah, absolutely. Good. So I think social media is a big part of building the relationship and having the trust kind of right on the forefront of people wanting to then do procedures with you guys. So give us your social media handles so we can wrap up our show today and let people find you, watch you, and then potentially look at opportunities to be able to have you be their doctors and their high-level estheticians. Do you want to start?
Sure. On Instagram, it's Kim Clark Skin, or email, it's kimclarkskin@gmail.com.
Perfect. And your actual facilities are in Oregon. So for those people that are local to that marketplace, go visit Kim for sure. Yeah.
Thank you.
Good. And Dr. Cohen?
So despite it just saying doctor over there, which is obviously a technical glitch, my name is Robert Cohen. So my Instagram is @RobertCohenMD, so RobertCohenMD, and my website is www.drrobertcohen.com, so DRROBERTCOHEN.com. So between those two, people can get full access to my offices and Instagram.
Perfect. Great. Thank you for being on. And Dr. Emer?
So my Instagram handle is JasonEmerMD, JasonEmerMD. And our website is jasonemermd.com. But our new website, Emerage Medical, which is our group of doctors, is going to be coming out very soon. EmerageCosmetics.com is going to be coming out very soon with our skincare lines.
Nice.
And then our Instagrams before and afters, Dr. Cohen's and mine, will be coming out very soon. So stay tuned for those. The biggest thing, though, I think in trend and social media is actually YouTube. We do a lot of lives and we post a lot of those Snapchats actually to our YouTube. So my YouTube handle is JasonEmerMD. We're seeing a very big spike from Instagram to YouTube. So I think that that's where a lot of people are going. The website is almost like your brochure now, but the YouTube is like the relationship developer and the Instagram.
Yeah.
So.
Yeah, it's like the pre-consultation for you guys. Well, thank you. You've been very knowledgeable, very informative. I always feel more comfortable after having these conversations with my guests because I want my listeners to feel comfortable feeling beautiful from the inside out, of course, and to not have that fear of saying, hey, I want to check into this. And there's so many new procedures out there and new technology that's available that I think there's probably a service or a treatment for everybody to feel their best and look their best.
Thanks for having us.
Yeah, you bet. Thanks you guys so much. Join us next week, everybody, because we're going to continue this conversation. We're still going down the path of talking about skincare and healthcare and all of that and how the beauty from the inside is very, very important to look our best on the outside. And I know that our guest today, Kim, mentioned that a little bit, but what you eat, what you drink, all of that plays a factor in having nice glowing skin for the long term. So stay with us for our show next week. And then as we go into fall, we're going to be talking a little bit more about wellness and how to be able to live your best life. So continue to keep joining us here every Thursday, 5 p.m. Eastern Time on the Voice America Network, as well as our channels on iTunes and Spotify and other channels as well. Thanks for being with us today. As always, thank you, my guests. Appreciate all you guys being here today. And remember to always be you in beauty.